Okay, about 10 years ago, I became aware of the problems with the healthcare system, which I had participated in fully over the years as an orthopedic surgeon. I realized that, hey, maybe we're not serving the best interests of our patients, and maybe the priorities are maybe focused more on profiteering and things of that nature. And so, it was obviously a painful realization for me, and something that, you know, I see a lot of people really realizing this. A lot of it, we just complain about it. Well, this sucks, and it's just an awful system. But fortunately, I'm very excited. Today is something really important. Uh, as we realize the problems with the healthcare system, you can either sit there and complain about it, yell at the TV set or whatever, as people often want to do, or you can actually do something about it. And I decided that let's do something about it. And so I'm very happy to announce that tonight at Rivero, I'll have my first actual meeting of our new sort of patients that have just enrolled for their working their way into the system. It's the first time I get to meet with them, and I'm very excited about this. And this 10-year process, this building this company took place several years ago. Over a period of several years, we raised, something like $5 million, a lot of it from crowdfunding from people that felt this is the right way to go, where we actually, start focusing on what medicine should be about: fixing people, treating the actual disease, not just constantly medicating symptoms, right? And so, hiring, employing dozens of people, engineers, quality assurance people, content producers, clinicians, operations staff, and so on and so forth. This has been a long journey, and we're finally, seeing this lift off the ground. I'm super excited about how this is, and to the people that will be joining Rivero as clients, as customers, as patients, you guys are trailblazing as well. We are changing the paradigm of healthcare for the better in a way I think it is absolutely needed. So I'm very excited to meet with those first sort of trailblazers, as I will as patients. And hopefully, as time goes by, those dozen employees will grow to hundreds, and then eventually thousands of employees. And then the patients, the handful of patients we're treating now, will continue to grow and grow. I mean, there was something like 8,000 people on the waiting list. So this is obviously something that a lot of people want to see, and it's our job now to execute. And my goal is, the only way that I feel that we can be successful is if we can actually deliver on getting people healthy. And when I mean healthy, not just, again, medicating them. I'm talking about, let's get them off the medications. Let's actually fix the underlying problem so that they aren't become chronic, lifelong patients. I mean, that's really what you don't want. I mean, the healthcare should be about, you're broke, let's fix you, and then you don't need us anymore. That's my goal. And so I think, it's kind of a bad business model in a way, because most of the business models, the drug companies, they want you to be on these drugs forever for lifetime recurring income. Well, I think there is a need for what we're doing, and I think there's enough people that are absolutely sick and tired and frustrated with this constant, merry-go-round of medications and procedures that last your entire life and sucks the life out of you literally and financially for the rest of your life with this healthcare system. So, as I said, I'm excited about this. This is, like I said, this has been a long time coming, and while we're at the liftoff phase, which is certainly exciting, we have a long ways to go. And the only way we're successful is, by having people that are willing to, try this. And so, as I mentioned, Rivero.com, there's a waiting list. We're licensed in all 50 states. We just started up, bringing people on. We'll be continue to as we hire more clinicians, like I said, we couldn't hire a bunch of clinicians until we had patients yet. So it's one of those balancing acts. And so we now are in the process of hiring more clinicians, so we should be able to open up more. So if you are on the waiting list, be patient, give us some time. We'll be reaching out to you via email in the near future to invite you to participate. And like I said, it's all of us, guys. It's a grassroots movement that's going to change the healthcare system. And I think the demand is there. And like I said, I'm excited. I'm excited not only to start this, but also to improve as time goes by. This is something that we're going to continue to get better and better and better with input and success and failures, to be honest, to see what's the best way to do this and to really dig into this. and figure out what it's about. All right, guys, you have a great one. I'm excited about tonight, so we'll talk to you soon.